About 30 minutes north of Hobart, New Norfolk is the Derwent Valley's biggest town. It's known for its heritage buildings and antique shops, but there are also hundreds of brand new homes and more developments in the pipeline. Here, the most common jobs are labourers, tradespeople and technicians, community workers and carers, and the median household income is lower than the state average. The GP clinic in New Norfolk has more doctors than it used to, but with thousands of patients on the books, it can take weeks to get an appointment. There's also no after-hours doctor's service, and mental health services are limited. But there are some programs trying to make a difference to health outcomes in New Norfolk. It's half a century since Ralph Peters started working as a district medical officer in New Norfolk. The Derwent Valley's health services look a little different now.
Oh, there's been a great change. When I came here, there were 2 GPs.
Hello, Dr. Ralph.
Hello.
As a GP, Dr. Peters offered maternity services and emergency care. Those services are now in Hobart, but the local hospital provides more subacute, community and allied health services.
So there's been a gradual improvement in the facilities for the past, since the 60s.
So just draw a rhomboid.
Dr. Lester Popinko is guiding a new generation of doctors. There are now 9 GPs, including 3 registrars in the Derwent Valley.
So now we're going to decide where we want to borrow the skin from.
The Derwent Valley Medical Centre has 12,500 patients who wait between 1 and 3 weeks for an appointment. Last year, more than 77% of Derwent Valley residents were overweight or obese, much higher than the state average. 38% of locals assessed their own health as fair or poor, compared with almost 22% of Tasmanians. And in 2017-18, almost a third of the Derwent Valley population had mental health or behavioural issues. Psychiatry services are limited, and there are lengthy waits to see a psychologist, on top of the time needed to get a GP referral.
It's disheartening to know that if somebody is feeling that way, that they might have to wait several weeks to see a GP, and so, by then it would certainly be too late.
The clinic wants to attract more GPs to address the bottleneck at the referral stage. But the federal government classifies New Norfolk as a regional centre, the same as Hobart. That means there's no financial incentive for doctors to choose New Norfolk over the capital city. If the clinic were just a few kilometres away in Lachlan or Plenty, doctors and the practice would be eligible for rural incentives worth thousands of dollars. A Federal Health Department spokesman says there's no discretion in the classification system, which is based on the census. But New Norfolk could recruit from a larger pool of doctors, including international graduates. There's no local doctor available after hours or on weekends. Bell Bird's pharmacy picks up some of the slack, but low health literacy also creates demand for the town's only ambulance.
When people don't understand what their options are, they end up just in a panic in the middle of the night, and 000 is their only option at that time.
Some residents are taking control of their health.
Hello, ladies. How are you? Welcome.
Strength and balance classes are part of a program for people with chronic conditions.
A few years ago, I broke my ankle and I went to balancing classes and I found them so beneficial that I decided I needed to do that to keep myself active.
I think a mental thing as well, because it does make you use your brains instead of slacking off.
How much do you need to hold on that chair?
The Rural Primary Health Program offers care coordination, allied health access and telemonitoring for about 300 clients.
And their ability to understand their condition and therefore seek help, appropriate help for their condition, that's what we're starting to see change.
Kicking the poor health outcomes that are stretching local services. There are several developments being planned for New Norfolk, including some potential health projects. Corrambine Care wants to create a health hub in 2 old hospital wards at the former Willow Court site. Those plans could include a GP practice and more allied health. Developers from Queensland are planning a new residential and commercial precinct. 700 residential lots are already being constructed, and the developers want approvals for a childcare centre, retirement village, hotel and 100-bed private hospital. A new rum distillery in Willow Court wants to create a cellar door, restaurant and boutique hotel. And the popular Agrarian Kitchen is looking to move its cooking school and garden closer to the Willow Court restaurant. Ben Shaw is the Mayor of the Derwent Valley Council. Ben Shaw, you've got a lot of potential development coming forward for New Norfolk. How is the council going to make sure that you have the skills in the town and in the Derwent Valley that will match those construction, hospitality and potentially health jobs that come up?
Yeah, so what we're doing at the moment, we're partnering with our neighbouring councils in our sub-region group, so Brighton, Central Highlands and Southern Midlands. And we've actually employed a workforce coordinator, and that workforce coordinator has been funded by a grant from TCF, so Tasmanian Community Fund. And that will go and identify what jobs are needed and identify the people in the community to be able to fill those jobs. So we think, we've got quite a large unemployment rate here in the Derwent Valley. We think we've got the people here, and we just want to link them, local people with local jobs. So we think the people are here, we've just got to try and link them. So that's what we're trying to do at the moment.
And do you need to make sure that those training facilities are in the town to match the jobs?
Yeah, absolutely. Very similar to the education. Education is a real struggle here in the Derwent Valley, and it's just about those linkages. We have poor public transport, we have poor access to sort of higher education. The year 11 and 12 at New Norfolk High School has been great to try and retain some people in higher education, but it doesn't offer all the courses. So what we're calling for is some regionalised TAFE. We'd like to have some sort of TAFE system out here in the Derwent Valley. We have a facility here which is right next to the high school, so it's a career education park. And whatever happens with whatever's going on with the revamp of the TAFE system or vocational training system, we'd like to make sure it includes some regional training because we know that people aren't going into Hobart to find those training opportunities. So if we bring the training to them, I'm sure we can upskill them and make sure they're ready for all the jobs that are coming.
New Norfolk has traditionally had low education and employment levels, and young people in particular have struggled to find work. But the Child and Family Centre is creating a better start to life for local children. The high school has extended to Year 12, and the PCYC is running programs to keep students engaged.
So it looks like we're at a childcare centre, but we're not, are we?
No, we're not at a childcare centre. This place is called a Child and Family Centre, and it's very, very different with a very different purpose.
At Ptunarra Child and Family Centre, playtime is precious. The government-run space encourages parents and children to connect with their community.
Parents are always here, not just supervising their children, but learning new ways of parenting, sharing ideas with other parents and us.
Yeah, on there. This one. Good job. Parenting isn't always easy in the Derwent Valley.
Family violence, we see a lot of families who are struggling to get permanent accommodation and housing.
The purpose of this Child and Family Centre is to get kids and parents in New Norfolk engaged in their learning from early on. For about 23% of people here in New Norfolk, Year 10 is their highest level of education. To compare, only about 17% of all Tasmanians don't go beyond Year 10. What's more, only 5% of locals go on to do a bachelor degree or higher. Before 2016, if senior students wanted to study Years 11 and 12, they had to travel up to 35 kilometres to attend college. But New Norfolk High has since expanded, allowing students to finish their education in the town.
There would be a lot of families where the parents didn't go through to Year 12 because that's just not what was done at the time.
The senior cohort now has more than 50 students, but there's been a dip in continuation in recent years.
Educational improvement is something which does take time, and so it's a journey that that we're very committed to.
Before the school extended, Jemma Foley wasn't considering studying past Year 10.
being in the place that not really knowing anyone, new area, all that sort of thing.
To keep kids from disengaging, the Police and Community Youth Club has 2 staff members placed at the school, running sport programs.
Yeah, it sort of comes down a bit, and yeah, like if you're frustrated in class or something, you can come out and just hang out.
So more's being done to keep kids in school longer, but unemployment remains an issue, made worse by COVID-19. 16% of working age people in New Norfolk were on job seeker or youth allowance as of June, compared to 10% the same time last year. And there are still significant barriers to employment, including travel and a lack of training.
It is quite hard to find a job in New Norfolk, just because all the normal shops and stuff that are really looking for people are in the main cities.
After finishing college, Leah Wakefield endured a year-long job search before finding local work.
My days probably were just resumes, handing them out everywhere that I could.
Local employment programs are trying to make a difference. Youth worker Matt Hill believes the town's growing hospitality industry is the key.
I can only hope that that's going to create greater employment opportunities for young people.
Alexandra Alvaro, ABC News.
The drive from Hobart to the west coast of Tasmania, or Mountfield National Park, winds through the picturesque Derwent Valley. For many years, that journey was able to be made by train. Now, a group of volunteers in New Norfolk is committed to getting the engines rolling again. Trains haven't travelled on this line for over 15 years, but that hasn't stopped a dedicated group of volunteers in their tracks.
I can't think of anywhere else that I've ever been in my travels that would match the scenery of travelling by train up the Derwent Valley.
With about 140 members, Derwent Valley Rail has been maintaining and restoring locomotives and carriages in the expectation that one day soon the public will be able to experience a train trip around the Derwent Valley.
If we don't keep them, operating and in a serviceable condition, they'll just deteriorate and we won't have anything.
From 1990, the organisation ran successful passenger trips and remained self-sufficient until the Derwent Valley line was closed by Pacific National in 2005. The trains and carriages are now lying dormant at the old railway station in New Norfolk.
All the bits of the jigsaw puzzle are here. We've got the locomotives, we've got the rolling stock, we've got the railway line most importantly, and of course such a group of dedicated people that just spend their weekends here.
Every Wednesday and Saturday, the old New Norfolk Railway Yard is bustling with activity.
I'm an artist as well as an architect, so I really like history, but I really like texture.
It's like old stuff and you get to maintain it all, and yeah, it's really fun.
I had to start work the first day I was here, and I don't think I've stopped since.
The volunteers aren't all local. Some travel for hours to work on the trains.
One of the things that I really like about coming out here is things being made. Lots of sort of magical things that you don't see so much these days.
Ages range from 13 to 85, and there's a focus on passing knowledge on to the next generation.
A lot of the skills that are required here are skills that are going to be lost in the very near future, and they need to be passed on.
As the locomotives and carriages are slowly brought back to life, there is one dream that keeps everyone coming back.
I hope that in the next 6 months we can put a train on the line outside this yard.
I would love to see this railway up and running on a regular basis. I'd love to see it employing people full time. I would also like to retire one day and drive trains.
I'm happy to be a guard at the back of the train, or I'm happy to be at the front as a fireman or eventually possibly a driver. Being on the train and having it running would be what I'd look forward to.
If trains could run on hope and determination, then surely it's full steam ahead. Ellen Coulter, ABC News.